There's something that tends to trip up a lot of new coders, and that's NCDs and LCDs because we have so many things to learn in medical coding, and we tend to really hone in on all of the details of CPT coding and ICD-10 coding and abstraction. We forget about some of those concepts that maybe we missed early on in our coding training. So NCDs and LCDs are something that you can kind of easily forget after you've like passed over that chapter early on and you just only touched on it a little bit in your studies. So when you actually then get into medical coding and you need to look them up or use them, or you have a test question on them after you haven't covered that chapter in a long period of time, you can get a little bit lost. So let me help you out with a bit of an overview. First, let's cover what is an NCD. So when you hear the term NCD, that is National Coverage Determination. And these are policies that are created by CMS. CMS is the Centers for Medicare and Medicaid, and they cover these at the national level. So this is something that applies to all beneficiaries of Medicare and Medicaid, no matter where they live, because it's a national policy. So if Medicare says something is covered or it's not going to be ever covered in a national coverage determination, that is the rule across the board. So the NCD covers things like what diagnoses might support medical necessity or what conditions might support medical necessity, what procedures are covered and when they are considered reasonable and necessary, and even things like frequency limitations. So how many times can you have this service covered in a year or a certain period of months, et cetera. And these are the big federal level rules, and you can find them on the CMS website, which I'll show you in a second. And they're super, super important when you are dealing with especially Medicare patients. Now, LCDs, those are our local coverage determinations. So those are issued by our Medicare administrative contractors, or what we refer to as MACs. So a MAC is a company that is privately contracted by Medicare to help process Medicare claims, to help handle payments, provide customer service, and they do that in a certain like healthcare region. So I'm in a region where my Medicare contractor is Novitas, which a lot of people like because they have a lot of very good information on their website and they have a lot of good training. But they also help enforce Medicare's rules and some of their coverage policies. It's almost along the lines of like a franchise. They have to follow like the parent company rules, but there might be some little tweaks here and there that they can make. So these local coverage determinations, they fill in some of the gaps where there's either not a national coverage determination or they provide additional rules or guidance based on some of the local coverage decisions. So for example, one region might have a local coverage determination that allows for coverage of a procedure, but another region doesn't, or maybe they require a different level of documentation or detail or frequency. Now, if you're curious about what is your Medicare contractor, I will have the map display here. So my MAC, again, I'm in Pennsylvania. Mine is Novitas, and they are really, really a great Medicare contractor, but there's some others out there like Noridian that are good as well. If you are coding or billing for Medicare and your code isn't supported or doesn't correspond with a national or local coverage determination, the claim could get denied, and even if it is like a valid code. And where we see this be kind of especially important is things like diagnostic testing, certain therapy services, DME, or any procedures that might fall into like a gray area of is this medically necessary? So for example, we have a lot of plastic surgery procedures that are sometimes considered cosmetic and sometimes considered reconstructive. So if it's reconstructive, your insurance will pay for it, but we have to outline like what is considered reconstructive versus a cosmetic procedure. And that's where these kind of policies come in. So being familiar with these coverage policies helps you know which diagnosis codes are likely going to support coverage and avoid some of those denials, and also help you educate your providers if they are not quite as specified maybe as they should be in the documentation to meet the policy requirements. Now, you can find the NCDs and the LCDs on cms.gov. There is a search on their website, so you can search for it by keyword. You can search by CPT code. I will link the search below. It's called the MCD, the Medicare Coverage Database. And this is what it looks like. So if we have a patient, let's say we work in like general surgery or bariatric surgery, and we need to know the bariatric surgery policies, we can just search by keyword. We could search by CPT code. I like to search by keyword. As long as you know the right keyword, that will work. But let's say I'm here, I want to do just a search for bariatric. It'll come up with a lot of the billing and coding specifics. So we don't want to use these to lead physicians, but we want to make sure that they are documenting these diagnoses appropriately so that they can have everything captured and making sure that if the medical necessity is there, that it's appropriately captured. So anyway, they're going to give us a couple of different types of articles in here. They're going to give us listings of what contractors these might apply to as well. So you can filter here. So if I want to filter by my contractor, so my contractor is Novitas. So if I want to go and make sure that I'm doing stuff that just applies to my region, and remember, this is the region that the patient is located in, not necessarily the region that you personally are located in, because you might be a medical coder in Kansas and coding for services that are over in Kentucky. So let's take a look at here. Here is, we have the LCDs, we have the articles, and then there's a lot of other information in here as well. These are articles. So if we click on the LCD, it'll kind of give us some general information about coverage, like what kind of procedures are covered. They'll give you information about like the comorbid conditions, for example, with bariatric surgery, they might cover it for obesity, but then they want to see that it's not just that the patient's obese, they have a comorbid condition, like they have sleep apnea or they have a heart condition. And in those cases, that's what they're looking to have. So this is just the information about all of the different things like, how to handle if the patient has an incidental cholecystectomy. So let's say we open up the patient and we see that their gallbladder is infected or looks like it has some kind of disease in there that it needs to be removed as we're have that patient open and we're doing that surgery. So is that going to be covered? When it says incidental cholecystectomy is covered. So it gives us some of that coverage information. Now, when we go to the article, that's the more coding-y kind of piece about it. So this LCD article is where we will find things like the CPT codes that may or may not be covered. And they're going to say, here's like the group of them. And sometimes they'll include things like the ICD-10-CM codes. So we'll cover maybe the CPT codes, but they have to have, maybe at least one of these diagnosis codes, or they might have to have one code from group 1 and another code from group 2. So we can see here there's a lot of diabetes stuff that they'll cover this for. And if we keep scrolling, we'll see some of the other diagnoses. And then here's our group 2. So this might be something where it's like, we have to have 2 diagnoses, one from this group and one from the other group. And then we also have at the very bottom some revision history. And let me tell you guys, I used to have a coding director that would flip out every time there was a notice that came out for Medicare that was like, there's been an update to this coverage determination. She'd be like, Victoria, make sure that you review this coverage determination. It's going to take you this long time and you're going to have to review all this coverage and figure out what changed. And I would scroll to the revision history and it would just say like, we realized something was spelled wrong and we changed that. But she'd be freaking out. She'd be like, oh my God, this changed. Make sure that you cover this with all of your coders, whatever changed. And I'm like, look, like I looked at it. Do you see this revision history here? Because on this revision history, it just says that it was just a couple of words that were wrong, or they added like maybe one diagnosis code or something. So not earth-shattering changes. One of the cool things too, though, about the local coverage determinations with Medicare is a lot of insurances will have policies that are kind of similar to Medicare. So if you see that Medicare covers something, oftentimes the coverage for other insurances will be similar to this. And we do see that again with bariatric surgery. I used to work a lot with wound care. So there was a lot of considerations with coverage there of like how many times you could go in for wound vac and different services there. So it's good for a coder to be familiar with the coverages just so that we can see a lot of the bigger picture that's going on. So we don't want to lead physicians, but we want to make sure that everything is being captured appropriately. So for example, a coder might get a surgery and they might code it 100% correct based off of what was documented in the medical record. But it might go to insurance and then get denied because what was documented and what was coded wasn't on that coverage. So they didn't have the right diagnoses. And someone working denials then might get that and they go, this was denied, and take it back to coding for review. And coding might take a look at it and go, you know what? Let me take a look and see if this is coded wrong. And sometimes what I've had in the past, at least, is we might get something like that and look at it and go, okay, yeah, this was coded correctly. But if we take a deeper dive into the patient's medical record, we might see that, the patient did have this condition, but it wasn't on the note for that surgery. So if we see, oh yeah, this patient had a past instance of having one of the covered diagnoses, but it somehow didn't make it onto that note because every note stands alone, we might then be able to say, hey, can you contact the provider and say, hey, did this patient have this diagnosis? We saw that they had it earlier in the year, or they can contact the provider themselves. Sometimes coders do directly communicate with providers to do things like queries or clarify documentation. So yeah, you might have cases where a patient is getting a removal of the nail bed because of an injury, and the procedure note just documented, broken nail. So that went to an unspecified code, and that wasn't covered. But if they have had like a crush injury, that would have been covered, and maybe the provider just, they were being lazy that day and didn't document it correctly, or maybe they were overwhelmed because our healthcare system is not great. So if we get that denial and we see that it was an unspecified code, someone in revenue cycle might then contact the provider to clarify the documentation, get that specified code, get it back out to insurance, and make sure it gets paid. However, in some cases, as much as it absolutely sucks and I wish it was otherwise, sometimes that patient genuinely might not have a diagnosis that's on that covered list. And that's when we run into issues of insurances trying to pull a fast one and saying, oh, well, it's because your provider or your billing office coded it wrong, because they want to just push the blame on the doctor versus admitting that their policy is trash. Now, another really cool thing I want to bring up is that a lot of encoders and coding software will have built-in tools to help you get that coverage information a lot easier. So, for example, I have Select Coder, and if I look at a code, like a skin lesion removal, it will tell me the pertinent coverage policies and it will have links right to them. Let me show you. So let's say I'm in Select Coder and I'm validating all of my different codes. I can click on this code here and it will give me all of the information about coverage determinations, where they are. So it will link them down here if there are any. This one in particular doesn't. I think the lesion codes, though, do. So let's take a look. So like here for our excision of benign lesions, it'll have all of the cool information in there about like descriptions of procedures, the guidelines, and then right here is our local coverage determination policies. And it will tell you which Medicare contractor it's for. So if I wanted to go right to the Novitas one for their coverage determination, I could see that. I could hit the show codes. Okay, so this one is saying they don't have specific codes for, but if they did, like that one with that bariatric surgery we're looking at where it had those lists of diagnosis codes, it would show them there. And a lot of coding software like Select Coder, like Codify through the AAPC, they will have these embedded in them so that when you look up the code, it will show you all of those different coverage policies. So just remember, the NCD is the national coverage determination, means everyone in the nation has to follow it. LCD is local, so it depends on your Medicare contractor, and both can impact when something gets paid. So I hope this helped you out. If you found it helpful, don't forget to like, share, and subscribe. Don't forget to drop your questions in the comments. I will see you guys in the next video. And until then, just keep on coding on.